Welcome to Pain Pal Conversations, where we bring together expert advice, science, and real human stories to empower you to take charge of your bone and joint health. Today, we're diving into a topic that's been requested by a lot of the women in our community: the connection between menopause and arthritis. I'm honored to be joined by Dr. Binita Priyambada, Senior Consultant in Preventive and Family Medicine and Medical Director at Even Healthcare, a pioneering healthcare startup. Dr. Benita will help us understand how menopause impacts bone health in aging women and what proactive steps can be taken by these women to support lifelong bone health. I'm Ashani from Pain Pal, and together we'll explore practical, science backed ways to build a stronger, pain free future. So, hello, Dr. Priyambada. If you'd like to start off with a brief about what exactly is osteoarthritis and what it means for women.
So first of all, I'm very happy to be here, Shani. It's a very important topic for a country like India, where women, basically all over the world, women have been putting their needs last and focusing on everyone else. And what that does, it delays their own, like discovery of their own ill health. And bone joint health is a part of that, especially more so in India, this is the case. And people reach out too late and people don't focus on prevention. So you asked me what is osteoarthritis. So osteoarthritis is a degenerative disease, meaning it's a disease of wear and tear. So basically, the joints, the big joints of the body, like hip, knee, they have on top of the bone, they have a protective layer of cartilage covering, and that cartilage basically helps in gliding of one bone on the other on the joint, and there aren't any injuries because of that lubricating effect.
Right.
And if the bone starts getting denuded, that's when those are the advanced stages of osteoarthritis. So as it is a degenerative disease, you can imagine that things that can slow down the wear and tear, you want to be doing more of that, and things that can kind of make it more speedier, you want to do that less. So more or less that's the gist, and this is why this impacts the bigger joints as opposed to the inflammatory arthritis, which impact the smaller joints. You must have heard about rheumatoid arthritis and all. Yeah.
Okay, thank you so much for that. So you spoke about how osteoarthritis is more common in India. I would like to ask if it's more common in Indian women than men, and if so, what are the factors that play into that higher number?
So, small correction, I wouldn't comment on the prevalence of osteoarthritis being more in India as
Okay.
opposed to the world. But
Okay.
when it comes to men versus women, yeah, women, 60% of our osteoarthritis happens in women, and it also starts peaking after age 40. So that's why the menopausal link, basically comes into picture. But other than the link to menopause, there are other factors as well, which by themselves also contribute to osteoarthritis being higher in women.
Okay, understood. So amongst women, are there any specific groups that you'd say are more likely to develop osteoarthritis other than just, women over 40?
Yeah, so weight is one of, so basically, the weight bearing function of the body is, it is the hip, the knee, they take a lot. And especially when you're taking a stride and putting all of that on one lower limb, right? So it has to be geared towards carrying that weight. And the more the weight, the more the strain. So that is one thing. The other thing that is very underrated and which is very common, I'm sorry to say, in Indians is we don't exercise by, like, we're not by culture very active people, and especially women, it's like it's almost culturally men exercising has still gotten accepted, and people do that and it's gaining traction, but in women it's lower and lower, and especially once they have babies and the family needs attention and all, that goes down. So what is being discovered is exercise not only around the knee, but overall body exercise kind of it recruits the muscle group into giving positive properties, because now we talk about crosstalk in medicine. So muscles have a crosstalk with liver, they have a crosstalk with other organs, and that's how the inflammation is kept down, and the functional aspect is kept up by exercise. So these are the two, weight and exercise, that put you at risk. Since this is not an inflammatory condition, so others autoimmune, etc., are not a causative factor for osteoarthritis.
Yes, thank you for that point. Exercise is very important regardless of gender. Yeah, so I'd like to get into screening now. What role does screening play in early detection of arthritis, and how can women get screened?
Yeah. So there are two aspects. So, basically screening as a process is when there haven't been any symptoms and pick up the disease. That is by definition screening.
Okay.
And in that sense, screening for osteoarthritis actually is not something which is recommended at the population level, because by the time that X-ray picks up osteoarthritis, typically there will be some symptom. Pain is the most sensitive symptom. It will already have occurred. And to diagnose this before that, one has to resort to MRI and all, which are very advanced, testings, and they do not kind of have the payoff. So basically, when we say screening, we should mean one's own sensitivity towards the function of the joint. So range of motion should be maintained. You should be able to do all the climbing and getting down the stairs. All the things that constitute the normal activity, they should be painless. Second thing is the range of motion can also be if you the moment you notice the smallest little pain, do not ignore and get those things, the functionality compromise and the muscle strength and the range of motion, all of those tested by either a physiotherapist or an orthopedician. So that's what the a classical screening such as we do for say breast cancer and all doesn't make sense here, but one has to be watchful for am I getting this, and if I'm getting this, then what should be my next step like that.
Got it. Thank you. So, what are some effective preventive strategies for osteoarthritis, other than exercise, of course?
Yeah, yeah. All right. So you can kind of guessed it that I was going to go to
Yeah.
exercise second and wait. The other thing is some supplements are actually seeing a good lot of research. I wouldn't say unequivocally supportive research, but good acceptance. So omega 3. So vitamin D we all know. So vitamin D is required for bone health. Other than that, it also has anti-inflammatory properties, and even in metabolic health, it has a role. So vitamin D levels are important, and because again the lifestyles have changed, we are mostly in house and we cannot expose ourselves to the sun in Indian climate too much, most of us. So vitamin D supplementation, getting tested and maintaining it above 30, that is important. Others are omega 3, and there are some things called GAGs, which are glycosamine glycons. So basically, hyaluronic acid and chondroitin sulfate, and they come as a mix. So any joint care or those kind of names of capsules, they do show some benefit in kind of keeping the inflammation low and protective lubricant effect on cartilage. So that is something which is again one should consider. Omega 3 you can also get from food, but fish oil capsules are what are also being recommended. So that is there. And then of course when you have slightest pain, after that what you do, so then you have to kind of when there's a flare up, you don't want to over exercise the area.
Right.
When the flare up settles, then you don't want to give up on exercise 100%. Other than that area, you want to continue with the exercise, that is another thing. And braces, so knee braces, so that the joint wherever, and this is something for which you need specialist help, because different braces will support different area. So you want to have that assessment done. If it has progressed a little bit more, then there's a very important thing which is not for joint but for your kidney protection. So be mindful of how much painkiller consumption is happening, which is safest. So you don't want to protect the joint or relieve the pain. You don't want to damage your kidneys, which can happen incipiently if you keep popping pain pills. So you want to know about how to manage the pain. What are the alternate strategies? And if it gets advanced, then there is also like function and balance get impacted. So fall prevention, that is another thing. So you would want to do that. So in the house, in the bathroom, there should be non-slip mats and railing should be there to support on both sides. Those are the kinds of things that you want to do.
Got it. Okay, thank you. Um, So you spoke about having things in your house that kind of help you manage your condition. In on that note, I would like to bring in caretakers into the conversation because I think that's also very important when talking about arthritis care. Is there any signs that they should be watching out for? Any tips and tricks you'd give them, or anything that you'd encourage them to do when taking care of somebody who has osteoarthritis? Yeah. Okay. It's fine.
It's still going on. Okay. So, yeah, I mean, it is very important that people should be able to lean in on family, and especially when someone is the primary caretaker, as it often tends to happen in households, there should be someone. So, you can start early, like, in late 30s and 40s, if the family doesn't have to be like caretaker in the traditional set, but something as simple as setting up an alarm so that vitamin D supplement can be taken by your mom. You can start from there. And if they complain about a pain, you make sure that they get an assessment, and then they have a plan to manage the thing from slowing, for slowing the progression. But as aging happens 60 plus and all, then it becomes a multiple, like there are multiple factors at play. Probably there will be blood pressure for which people will be taking medicine. There could be dementia setting in, or some kind of mental capacity compromise as well. On top of that, there might be arthritis. So all of this put together, even blood pressure, if people are taking medicine, there is a condition called postural hypotension. So that itself can also cause a tendency to fall, because it gives that chakkar sensation and dizziness, and temporarily, and if already your balance is compromised. So all of these things are important. So the most that you can do is, the family, the caretaker must have a clear cut conversation with the health caregiver, and understand it shouldn't be only on the aging person to understand what the care actually comprises of, because they will tend to kind of not do it. So it's just, I think, more of thoughtfulness, and not kind of forgetting that now the transition is happening where you are supposed to pull it up and help the person who has been giving care is important.
Yeah, thank you so much for that. You're right, it really starts with the little steps when it comes to caring for someone. So I'll move on to my last question. How can we manage pain and slow down the progression of the disease?
Yeah, so the first thing is that because it's a wear and tear thing, you don't want to do things that are going to aggravate. So you don't want to be doing high impact activities. Where, say, I don't suspect a lot of women are doing that, but at the same time, if someone is into jogging and all, you want to be softer surfaces, then fair bit of management of say stairs versus ramps as much as you can, weight bearing adjustments, which the orthopedics are the best people to suggest. They just shift where the weight should land, by, as I said, braces and orthoses, heel raises, etc., so that the weight bearing gets aligned and it gets distributed to the place which is less injured. And then to help recovery, anti-inflammatory, as I said, the supplements can, and weight loss has a impact to play. So these are the all the things. Unfortunately, nothing is like magically effective, but at the same time, one can, neither is it life threatening. So it is a balance between how much you can, keep your functionality and your mood up and your pain controlled, and it doesn't only depend on what the X-ray is showing as damage.
Right.
So that's what is important. Other thing which is very useful is water, like
Oh, yeah.
water-based exercises and all of that. If one can find a place to do this, so these are the ways.
Okay. That was all of my questions. Thank you so much for coming on here. Your insights were extremely helpful, and I'm sure we've all learned a lot more about arthritis. Is there any other points you'd like to add? Any advice? Anything to end this off on?
Just that when and I'm talking to the potential patients now, that if you start having something, just just looking for the perfect solution, that you don't have to go directly to an orthopedician to talk about your osteoarthritis. You reach out to the doctors and physiotherapists, general physician nearby. At least the help can start from there. And a lot of times people are looking for the perfect doctor, and they won't go to the we are all trained to at least help at initial stages. So the approach should be that when the primary physician is sending, the physiotherapist is sending, till that time, especially physiotherapists, they can help a lot, and they are more ubiquitous than finding an orthopedic surgeon.